Welcome to the Approach to Hypoxia Part 2, Ventilation in and out of the lungs. My name is Jason Wechter. In Part 1, we discussed the air outside, and we derived the equation for the partial pressure of oxygen that you breathe in. This presentation will discuss moving the air from the outside to the inside of your lungs, a process known as ventilation. Ventilation is the process of physically moving air into and out of your lungs. This is a mechanical event, not a chemical event, and there are two components, inhalation and exhalation. We can further break down ventilation into the two primary physiological components, which are respiratory rate and the tidal volume. The tidal volume is the volume of air moved in and out in one breath. Minute ventilation is defined as the volume of air that you breathe in and out in 1 minute. The minute ventilation equation is tidal volume multiplied by respiratory rate. Remember, the tidal volume is the volume you breathe in and out in one breath. So the number of breaths multiplied by the volume for each breath will give you the total volume that is moved in and out of your lungs in 1 minute. This is a fairly simple concept, but it's extremely important, and we're going to build on this concept in the next few slides. Before moving forward, there is a common misconception that if you are breathing fast or rapidly, that you are hyperventilating. Let's explore why this is not true. Remember that ventilation is the volume of air moved in 1 minute. The respiratory rate is how frequently you breathe. But what if you breathe frequently and you barely move any air in and out of the lungs with each breath? By this equation, we can see that the respiratory rate would be high, the tidal volume would be low, and it would in fact be difficult to predict what the minute ventilation is because we don't know exactly how much the respiratory rate increased, and we don't know exactly how much the tidal volume decreased. Therefore, it's very important that you appreciate the minute ventilation is not just the respiratory rate. The minute ventilation is the tidal volume multiplied by the respiratory rate, and you need to pay attention to both of these important physiological variables when you are thinking about how much the patient is ventilating. So how do we measure ventilation? Well, we could measure the respiratory rate, which is easy to do, and measure the tidal volume, which requires a spirometer, and we could multiply these two numbers together, and that would be one way to measure ventilation. And when we do this, we use liters per minute, and typical values would be somewhere between 5 and maybe 8 liters per minute, depending on the age, size, and gender of the patient. When you exercise, minute ventilation greatly increases, possibly by a factor of 4 or 5. So if I told you that somebody had a minute ventilation of 6 liters per minute, would you know if that value is appropriate or not? And the answer is you would not know. In order to determine if ventilation is appropriate, we need to think about carbon dioxide. Carbon dioxide is what we eliminate from our bodies when we breathe. When you ventilate more, what happens to your carbon dioxide levels? They decrease. So as you ventilate more, you eliminate more carbon dioxide. And the reverse is also true. When you ventilate less, your carbon dioxide levels will increase because when you ventilate less, you retain more carbon dioxide. In other words, you eliminate less carbon dioxide. This creates an inverse relationship between minute ventilation and carbon dioxide. When minute ventilation is low, carbon dioxide levels will be increased. In other words, hypoventilation results in hypercarbia. When this relationship is in the opposite direction, increased minute ventilation will reduce carbon dioxide levels. Therefore, hyperventilation results in hypocarbia. The respiratory center in your brain has a very important job, which is to maintain the same level of carbon dioxide in the blood at all times. The most effective way of determining whether the ventilation in your body is appropriate is by looking at carbon dioxide levels. If you have low carbon dioxide levels, this means hyperventilation is occurring. If there are high carbon dioxide levels found in the blood, this would provide evidence that hypoventilation is occurring. What causes hypoventilation? Well, the answer is anything that will reduce minute ventilation. We can reduce minute ventilation by reducing the respiratory rate, and this can occur with sedating medications such as narcotics or benzodiazepines or other medications. It can also occur as a result of a brain injury to the respiratory center. Another mechanism by which we can reduce minute ventilation is to reduce the tidal volume. This can occur in pretty much any lung disease, either intrinsic lung disease such as infection, inflammation, heart failure, fibrosis, or airway problems. If you inhale a foreign body, or you have reactive airways disease such as asthma or COPD. But also if you have neuromuscular weakness, so you just don't have the muscle power to move air in and out, and some chest wall deformities with abnormal ribs or an abnormal spine can also reduce the tidal volume. Can hypoventilation cause hypoxia? We know that hypoventilation certainly does cause high carbon dioxide levels, but does it also cause low oxygen? And the answer is yes, it does. Let's see if we can understand why. In this image, we show an alveolus and a capillary, and we show the alveolus right after somebody takes a deep breath in. Starting immediately, oxygen is going to diffuse from the alveolus into the capillary. Now let's imagine that this person is holding their breath. They are not ventilating this alveolus, and over time, more oxygen molecules are being absorbed into the capillary. As this process continues, the number of oxygen molecules inside the alveolus is going to go down. Therefore, the partial pressure of oxygen in this alveolus is also going to go down. As time goes on, more and more oxygen molecules will dissolve into the capillary, resulting in a PO2 in the alveolus that is now very low. And when the PO2 in the alveolus is very low, it will result in a low PO2 in the blood that is carried by the capillary traveling next to this alveolus. In summary, minute ventilation equals tidal volume multiplied by respiratory rate. And the definition of minute ventilation is the volume that you breathe in and out in 1 minute. A high minute ventilation causes low carbon dioxide, and this is called hyperventilation. Low minute ventilation results in a high carbon dioxide level, and we call this hypoventilation. Hypoventilation results in a low alveolar PO2, and therefore hypoventilation can cause hypoxia. We know if hypoventilation is present because the carbon dioxide level will be high if hypoventilation is occurring. This is the end of part 2, Approach to Hypoxia. The next part in this presentation will discuss moving oxygen from inside the lungs to inside the blood. And this section will have 3 subsections.